Greetings. My name is Marcus Dumas, and I'm a PhD candidate at the University of Georgia's College of Public Health. Thank you for coming to my poster presentation, Rethinking Sexual Health Education Curriculum. So as we think about the problem that we face around sexual health education, we see that there are many different disparities related to adolescent health behavior and outcomes. Adolescents who identify as ethnic minorities, especially those living in urban areas, are at a higher risk of sexual health disparities. We see that adolescents who are sexual minorities are at a greater risk for sexually transmitted diseases and infections because of their sexual behavior. And then finally, if we think about adolescents who live in urban communities, they are more likely to have sexual health challenges, including STI diagnosis and unwanted pregnancy. And so as we think about some of these key factors that can help us to understand the problem better, we see that the period of adolescence is really where young people are experiencing many different types of changes. And they're relying on a variety of sources to provide them with information, role modeling, and skill building. But the issue comes when we find out there's really no consensus on where high school students are going for information needs and what their information needs are. So we truly believe that we can benefit by understanding their perceived educational needs. We believe that this can help us to close the gap in literature and provide key stakeholders like myself with information to help students prepare to live healthier sexual lives. So we provided them with a survey that asked a lot of different questions, but we're going to focus on one question. This question really looked at them giving us information about what their perceived needs were. And so you see on the far left-hand side, there are 7 different topics that we asked them about. And we just really wanted to know, how well do you believe your information needs are being met related to those 7 topics? And so you see that the first 5, anatomy functioning, all the way up to sexually transmitted infections, they're yielding more to moderately well and very well, which is a good thing. But then we see the final 2, healthy relationships and personal safety, they're leaning more to the not well to moderately well. And so this might become an issue, something that we should start thinking about as far as what's going on and how can we better address the needs of the young people. So the recommendation that we provide, first off, is understanding that sexual health education is very important when we're talking about promoting well-informed sexual decision-making. There's a thing as far as making sure that the curriculum is really addressing what the needs are of these young people. So a recommended approach would be to improve the sexual health education. We have to think about doing a collaborative approach that really allows adolescents to form a youth advisory board that's going to give them the opportunity to really address which topics are most important to be included in the interventions. And they can work side by side with some of the academicians and public health leaders in the community to really talk about what intervention will be most appropriate for young people. And then finally, if we really think about the next steps, what's really important is the researcher really look to understand more about who would be the best person or people to provide information and why. So we know there's an exhaustive list, but what if we take that exhaustive list of individuals and we ask young people, so if you're presented with something such as understanding more about your anatomy, or you want to understand more about your orientation, who would you go to and why? And I really believe through that, we can really start thinking about some ways to improve the interventions that we currently have out there. So I want to say thank you for coming to this poster presentation, and I hope you have a great rest of your time in the conference. Thank you so much.